Can physical therapy or occupational therapy help with patients dealing with EDS, Ehler-Danlos Syndrome? The short answer is yes. I think the biggest way that we're able to help at Freedom is our ability, first of all, just to help come up with a clinical diagnosis. I think so often patients are walking around, for example, with headaches, with migraines, maybe some GI issues, some lower back pain issues, and maybe their knees hurt. But they're seeing their knee doctor for their knees. Maybe they're seeing a really great PT for their lower back. They're seeing their GI doctor for their GI related issues, and maybe a neurologist for their migraines. What we have come to find at Freedom, if you do a really good evaluation, and one tool that we use is the United Kingdom has an excellent EDS checklist that we will use to kind of systematically go through and provide at least a musculoskeletal assessment for what's going on, in addition to some questions. But so often, a lot of our more chronic patients or patients that are having multiple chronic overlapping pain syndromes tend to fall into the category of possibly Ehler-Danlos Syndrome, but they have never been told that because the appropriate screening has never been done, or possibly, the practitioners they're seeing, it's just not on their radar and they're not aware of it. So one of the ways that I find that we are very beneficial at Freedom is that we have clinicians here under our roof that are skilled in all of these different things that a lot of EDS patients suffer. So for example, we're pretty well known for treating issues with facial pain, craniofacial pain, TMJ, TMD related issues, temporomandibular disorders. Not uncommon, an EDS patient will have symptoms in this area. So we're able to help treat that. We also have headache and migraine specialists. So if they're also dealing with those symptoms, we can help with that. We have excellent therapists that are good at treating spinal related issues, pelvic floor therapists, who are very good at treating low back, pelvic pain, visceral issues where they can do visceral manipulation. So what I try to explain to our patients who might be suffering from EDS is, you have lots of little fires going on here. And if each of us can do our role at Freedom and put out a little bit of the fire or dampen the fire, let's reduce your migraines from 15 times a month to 3. Let's reduce your daily persistent headache down to 1 or 2 a week. Let's improve your neck mobility. Let's improve your jaw function. Let's get you over to our pelvic floor people that can help with any GI issues you might be having, any urinary incontinence issues or lower back issues. And then yes, if you're having musculoskeletal issues like shoulder and knee pain, let's get you to our sports expert here as well. So I think this concept of tag teaming and multidisciplinary approach, and that even goes outside of Freedom, We then also might have to refer to neurologists that we like, or physical medicine doctors, or maybe it requires rheumatology, Or a good massage therapist and acupuncture. Whatever belief our patients come in with, whatever we think that they believe can help them, that's what we want to tap into. So I definitely think that physical therapy and occupational therapy as professions, if they're skilled and knowledgeable and understand how to look for EDS and how to help treat it, we can do a very good job helping them manage their symptoms that unfortunately are probably there for a lifetime, but it doesn't mean they have to be in chronic pain. It doesn't mean that they have to stop functioning. We want them to continue to function, have a full life with activities and everything. So short answer is yes. Long answer, I provided you on, I think, all the things that we can offer for patients suffering from EDS.